Okay, in this video we're going to talk about Hidden History of Health and Nutrition by me, Pete Rogers. We're going to be talking about mercury today. So mercury is very underrated as a poison. And probably the two most common exposures to mercury are from dental amalgams and from eating fish. Okay, here's a book by Jane Hightower. She's a physician internal medicine doctor in the San Francisco Bay Area. And what was happening is there were all these yuppies becoming demented in their 40s. And nobody could understand why are all these really health conscious people becoming demented. And they would try to check their blood levels, their urine levels for mercury, amongst other things, and they weren't finding much. Okay, so what she did was she realized she had to check their hair, and she just told them, stop eating fish. And it turned out that that was the most useful way to reduce their mercury levels. And a lot of them recovered pretty well. Some of them didn't. It was too late. They'd already had extensive brain damage. So there's a lot of mercury in fish. You really shouldn't be eating fish. I know all the stupid people think fish is good for you. You know, it's got good advertising. Okay? The ocean is a sewer. All this mercury from these coal-burning electric plants and other sources goes into the oceans. And then it goes up the food chain to the high-ranking fish, you know, the salmon, the tuna, and all that. So she called brain fog, she called it fish fog. And she says, you got to tell them, no fish. Don't ever eat any more fish the rest of your life. And again, a lot of them got better. Okay, for dental amalgams, I recently wrote a book, Prevent and Reverse Dental Problems. And you can look up these writers, Hal Huggins and guys like Robert Gamal. And they said they just started extracting these teeth, just pulling the teeth out with the amalgams. You're better off having no teeth than having an amalgam. Now, don't get me wrong, lots of people have them and they tolerate them pretty well. A lot of people are good at handling the mercury toxicity. It does add up. It is cumulative. I do have some myself, but I do a lot of little things to be careful about. I would never brush over them. I don't hold a cell phone to the side of my face unless it's an absolute emergency, which almost never happens. And there's some other tricks too, but those are some of the key ones. I don't chew hard food. Okay. Yeah, so anybody who says you should eat fish for brain health is lying to you because, you know, you're going to get all that mercury. How's that going to help you? It's stupid. The whole omega-3 stuff is a bunch of nonsense, exaggerated. This is a great book. This is a masterpiece book. The author's name is Patrick Storterbrecker, and he's like from, you know, Sweden, Denmark or something. He does all this research back in the 1950s and 60s on mercury. And it's amazing how much they knew. There was like a dentist who had multiple sclerosis. He had more lesions on the side where he had more amalgams, and that tipped him off that it might be the mercury from the amalgams, because silver fillings are 50% mercury. And so he had them removed. And these dentists like Huggins and Gamal and others, they saw a lot of improvement in patients who they removed the mercury amalgam. Some people are really sensitive to it. They developed multiple sclerosis pretty quickly after getting the amalgams. So, you know, multiple sclerosis causation is multifactorial, and I think high-fat diets are the main cause, but mercury causation is one of them. You've got bidirectional veins from your mouth to your brain. And by bidirectional, I mean without valves, so your brain can drain if you're laying on the right side, left side, prone, supine, etc. And so the mercury is thought, you know, it can have a zero valence and be nonpolar and go across your blood-brain barrier and damage the neurons. And especially the neurons that are damaged are the ones adjacent to the veins, like adjacent to the lateral ventricles, perpendicular to the lateral ventricles, if they call them Dawson's fingers, because they look like little fingers as they stick out perpendicular to the body of the lateral ventricles. Anyways, his book was really clever, and he said, well, people tell him, well, how do you know somebody has mercury toxicity? How come more people don't have symptoms? And he says, a lot of them do, they just don't recognize them. And one of his big symptoms was called micromercurialism, whereby the mercury causes all kinds of low-grade symptoms all over the body, including autoimmune disease. It can be a hapten, meaning it'll bind to a protein, distort the shape of the protein, and that protein will then elicit an immune response. It can irritate the urinary bladder and cause people to have to void more at night. I think I had that. I have some amalgams, so I think I had that. I found a couple of ways to work around that. The best one for sleeping better for me has been to exercise a lot more, but I'll talk about that in separate lectures. I'm going to go through tons of stuff about sleep in future lectures. But if you're interested in mercury, this is an amazing book. Okay, the guy on the internet with the best lectures on mercury is Boyd Haley. You can find him over at IAOMT, International Academy of Medicine and Oral Toxicology. He's He's a biochemist, and they're the dental association that was formed in response to mercury toxicity and amalgams. But he's Boyd Haley. He's like the best biochemist in the world on the subject. Hal Huggins' lectures over there are good. So is Murray Vimy's lectures, iaomt.org. You can see their website as well, and then they have a YouTube channel. They're very good. See if I got anything else. Oh, this lady did some good work. Her name's Renee Dufault. And, I think I might have told you before. I don't know if it was with this book excerpts I told you. They found that high fructose corn syrup was often contaminated with mercury. And the food companies would advertise high fructose corn syrup as a preservative. The reason it was a preservative is because it had mercury in it, just like thimerosols use a mercury derivative as a preservative for contact lenses, okay, which can cause cataracts. Okay. Oh, and one little interesting side note, I used to wear contact lenses a little bit when I was in my 20s, and I went to the dentist in my early 30s, and he told me, Pete, you got cataracts. I go, what? I was in my early 30s. And I was wearing contacts with the thimerosal and the preservative solution. Well, anyways, I became a vegetarian around that time, and a little later after that, but I started improving my eating, and my vision is the same as it was in my early 30s. It never progressed. Dairy is a big risk factor for cataracts because people can tolerate the lactose. They can split the lactose in their gut with lactase, the glucose and galactose, but they might not be able to tolerate the galactose. Galactose is toxic to your gonads and to your eyeballs. So anyways, this lady tuned into the fact that high fructose corn syrup was routinely contaminated with mercury, and it was put into tons of food. And she let everybody know about it. It's a very good book, Unsafe at Any Meal. And she wrote about a bunch of other food toxins as well. And I have a friend who's a molecular biologist, biochemist, and he has another friend who did research on high fructose corn syrup. It was one of the early guys to figure out that it was routinely contaminated with mercury as they pushed it through a chloralkali vat in the process of making it. And, what do you think happened to him? Did he get promoted when he wrote this landmark paper on high fructose corn syrup being contaminated by mercury? Nope. The high fructose corn syrup industry pressured the university to fire him. The guy got fired. Got fired for doing something good. And that's how it goes in the real world, okay? The big corporations have a lot of power. So anyways, this is the focus of this talk today was just talking about mercury. And there's a lot of things contaminated with it. If you're worried about mercury toxicity, you can look up that Mike Adams book, Food Forensics. You can go to the Lead Safe Mama website. I think it's TamaraRubin.com, but her nickname is, her moniker is to call herself leadsafemama.com. And Consumer Reports often has papers about that. But so just be aware. Again, that's why you want to be a whole food vegan, organic only, is to minimize contamination with all these things. I think that's all I'm going to have with mercury for this talk here today. Okay, so I hope you found that helpful.